Hello viewers, how are you? Today we are talking about the carbohydrates, blood sugar and diabetes. In this presentation, I will provide an overview of carbohydrate, their roles in blood sugar regulation and the complexities of diabetes mellitus. So let's go and have a topic. Yeah, carbohydrates. That is called the body's energy source. The maximum energy generated from a molecule for the body is carbohydrates. Some essential nutrients. Carbohydrates provide the body with energy, powering the cell and modify function. Carbohydrate providing prevent the carbohydrate, for example glucose, break down into the particles into the byproduct. They will produce some kind of energy and water, and this energy is utilized by the body in different function of the body, like cell forming, cell empowering and bodily function. What kind of function your cells want to do, they need some kind of energy, and that energy comes from a molecule. The molecule is called carbohydrate. Number two, diverse form. There's a different form of carbohydrate. There might be simple sugar, there might be oligosaccharides, and polysaccharides are the primary carbohydrate categories. There's a different kind of dietary sources from where you can get your carbohydrates. Carbohydrates are found in a wide range of food, including grains, fruits, vegetables, and dairy products. Type of blood sugar. Now, number one, glucose. Description: the primary energy source for the cells. Every cell needs energy, and the primary source for the energy is called glucose. There's a different kind of sources for the glucose. There might be starch, sugar, and some fruits. Number two, second type of carbohydrate is fructose. Fructose is converted to glucose in the livers. Fructose is a kind of carbohydrate. When it moves towards the liver, and at that time fructose dissociate breakdown into the glucose. Number two, it comes from the main source of fructose is fruit, honey, and high fructose corn soup. Number three type is galactose. It converted to the glucose in the liver like fructose, and then mainly comes from the diabetes mellitus, a disease which is caused by increasing the amount of sugar in your body. Diabetes mellitus, a chronic condition, that means that disease go pretty long. You have to maintain yourself. You have to continue your medication for the long period of time. Type 1 diabetes, that is autoimmune destruction of insulin producing cell leading to insulin deficiency. Your immune cells will destroy the insulin producing cell, which leads the insulin deficiency. Another type 2 diabetes, insulin resistance and eventual relative insulin deficiency, often associated with the obesity as a lifestyle factor. Number three, there is a gestational diabetes developed during the pregnancy, usually revolving after childbirth, but increasing the risk of type 2 diabetes at the time of pregnancy. The number four is monogenetic diabetes, a rare form caused by the single gene mutation like MODY. A type of gene, when it's modified, it will cause the monogenic diabetes, a single gene modified just because of some reason, and you will suffer from the diabetes. Complications of diabetes mellitus. Now, when a patient is suffering from the diabetes, what kind of complications the patient is feeling? Number one, cardiovascular disease, increased risk of heart attacks. Number two, strokes and high blood pressure. Number two, second complication is neuropathy, nerve damage leading to the membranous pain and weakness primarily in extremities. Number three, retinopathy, damage to retinal blood vessel, potentially leading to the vision problem and blindness. Number four, nephropathy, kidney damage that can progress to the kidney failure. There is some kind of additional complication of diabetes mellitus. Number two, food problem, poor circulation and neuropathy infection and the potential ambitious. Number two, skin issue, increase the susceptibility to the infection and delay the wound healing. Number four, GIT problems, issues like gastroparesis where the stomach empties too slowly can Now come to the main point, blood sugar test, monitoring and diagnosis. Whenever the blood sugar level increases in your body, at that time you have to monitor the glucose level in your body, and the diagnosis is done by a medical technologist. Number one, fasting blood glucose test measures blood glucose after overnight fasting. A level of 1.26 milligram per dl are indicate diabetes. Whenever you are eating food at the night and your stomach is empty and you didn't get your breakfast, you didn't eat anything in the morning, and the first you monitor the glucose test, that test is called fasting blood glucose test, and the level is 1.26 milligram or high, indicate that you are suffering from diabetes. Number two, oral glucose intolerance, OGTT, measure blood glucose after fasting and then gain 2 hours after consuming glucose rich beverage. A 2 hours level of 200 mg per dl are the high indicator. Number 3, hemoglobin HbA1c test, measure average blood glucose level over the past 2 to 3 months, and HC level of 6.5 are the high indicator. Random blood glucose sugar, measure glucose sugar at any time, anywhere, not anywhere, but at any time, regardless of fasting. A level of 200 mg per dl at the high with limited symptom indicates. Now come to the carbohydrate digestion and absorption. Number one, the digestion starts from the salivary glands, and salivary glands is present on your mouth. Salivary amylase begin the digestion of starch into the simpler sugar. Then your stomach carbohydrate digestion continue but less active due to acidic environment. Then that sugar move towards a small intestine. Pancreatic amylase further break down starch into the disaccharide and oligosaccharide. And then when the starch is dissociated into the simple sugar form, at that time absorption happen in your body. Number one, monosaccharides are absorbed in the bloodstream through the interstitial links. So that is the end of the topic. If you like our video, please do subscribe and share with your friends. For the more information, please press the bell icon. You will never miss